Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan, giving our weekly update on the COVID-19 pandemic. We're very pleased to report that over the last week, this community has really come together by staying apart and keeping our numbers low. Since earlier this month, when Dr. Bogan and the Health Department put out some of the strategic strategies to deal with rising numbers, spiking numbers in many ways in this region. When we first saw numbers go into the triple digits, over 100, we saw consistent days over 200, and even 1 or 2 days where we approached 300 and beyond. Also within that realm, we were seeing 11 to 12% positivity rate. So it wasn't just that there were more tests being run, there were also a higher percentage. There were some strategies that Dr. Bogan and her team employed when they were able to isolate through contact tracing and case management, case investigation, where those hotspots were, and recommendations on things like bars and restaurants, travel, etc. And since the last week, we have seen those positivity rates fall into the single digits. Today, I think it was a little under 6%, and for the first time in a couple of weeks, we actually saw the numbers in double digits. It's really a credit to the folks of this community who take those recommendations and those mitigating strategies that the Health Department and Dr. Bogan and her team put out to heart. More people are wearing their masks over the last couple of weeks. More people are social distancing. And then, of course, along with the governor's and Secretary Levine's order regarding mitigation in the entire region and the entire state, actually, when it comes to limitations at restaurant capacity, eliminating bar, stand-up bar, etc. We've seen some improvement, but it's still early. We want to continue those numbers to continue to drop. We also know that the hospitalization rate has gone up, which is something that you do expect after you see cases go up, that what follows are hospitalizations and then unfortunately fatalities as well. So we're still in a big part of that. We also know that it would be very difficult to have spiking numbers as we head into the school year. We're a little bit a month away or so from the school year starting, and as school districts throughout the Commonwealth and the Commonwealth itself, with the Department of Education and Department of Health putting strategies and limitations in place, we know that's going to be challenging as well. So everything we can continue to do is in a positive way. I did want to talk about some of the work that the Health Department has done, because since the end of June, the Health Department has received approximately 1,900 COVID-related requests, and over 1,700 of those have been reviewed, completed, and closed, with another 100 of those currently in progress. And one of the things we've stressed from the very beginning of this pandemic is that we want everyone to do things as safely as possible to protect the public. We've also clearly heard that we should be providing information on which establishments are doing the right thing and those that are not, and that there remains to be confusion about what businesses are supposed to be doing. With that in mind, and with the help of the County Manager McCain, and other staff, a COVID field response team is launching tomorrow being Thursday. Team members will visit businesses in the community, check to see if they are following business safety precautions, including the state's universal masking order, recent orders regarding bars and restaurants, occupancy restrictions, and physical distancing requirements. Team members will complete a checklist during their visit and provide a copy of that checklist and education materials to management on site. The business's name, date of visit, and copy of the checklist will be posted to the county's website so that the public can see which businesses are working hard to keep everybody safe. Team members will initially visit bars and restaurants identified through resident complaints made to the department. If a team member finds a bar or restaurant not following all the required COVID-19 safety measures, they will alert the Health Department's food safety program, and an inspector will be sent out to do an inspection, which could result in the facility being shut down. At bars, restaurants, COVID response team members will check for the following: tables spaced far enough to allow for physical distancing, indoor capacity capped at 25%, staff and customers wearing masks, no bar seating and no smoking, dine-in service ending at 11 p.m., and signs reminding customers of the safety precautions. We're not looking to punish bars or restaurants, but we want everyone following the rules, and this team will be providing them with materials and resources that they need to operate safely. We also want to inform the public of establishments that are following those requirements. With that, I want to open it up to Dr. Bogan to give her weekly remarks, and then we'll open up to questions. Dr. Bogan?
Thank you, County Executive. All right, so good afternoon. It has been about 3.5 weeks since the first targeted mitigation action to try to slow the spread of COVID-19 in Allegheny County. That mitigation strategy was focused on what we know about how the virus spreads. The virus spreads through droplets that come from the mouth and nose, and you can become infected with the virus if you breathe those droplets in or touch a surface where they've been recently landed and then touch your face. Standing within less than 6 feet of others who may have the virus puts you at risk for the infection. That is why I've taken steps to reduce situations where people congregate close to one another, where mask wearing or keeping 6 feet apart from others is difficult, like a bar or restaurant where lots of people are eating, drinking, or smoking, or in large groups. If everyone who is infected with COVID-19 got sick, this virus would be a lot easier to fight. But because many people with the virus don't have any symptoms, we don't know who could be spreading the virus and who is not. It's a tricky virus, and a lot is still unknown. Unfortunately, there's also a lot of misinformation out there about the virus, how it spreads, how it affects different groups of people, and how it can be stopped. At the Health Department, we try to provide the best and most complete and up-to-date information. I encourage anyone with questions to visit the Health Department's COVID-19 website at www.alleghenycounty.us/coronavirus. You can find lots of information and links to lots more information on that website. The team at the Health Department has continued to watch the case data very carefully, and we are just beginning to see signs that the mitigation steps may be working. It's still a little too early, but we appear to be moving in the right direction despite daily case counts being higher than we had grown accustomed to a month ago. Daily new case numbers seem to have stabilized. The county reported fewer than 200 new cases every day for the last 5 days. The average number of new cases we've reported each day has dropped, and during the last week, we reported an average of about 150 new cases per day compared to the week before when we reported about 200 new cases per day. Our positivity rate has also declined. It is now below 10%, and in late June and early July, it was above 10%. Our testing numbers remain high. Over the last 10 days, for which we have complete data, we've averaged nearly 2,000 tests every day in the county. The data from our case investigations has shown a drop in the number of new cases reporting going to bars and restaurants. Between June 28th and July 4th, 221 cases reported either going to or working at a bar or restaurant, compared to only 162 between July 5th and 11th. Recent data collected by our case investigators shows a steady increase in the number of new cases going to private parties. Many of these were backyard barbecues or get-togethers. They were graduation parties, bridal showers, and birthdays. And I will say I'm so glad that people are getting together. Social interaction is very important. But that's why we've used the phrase physical distancing and not social distancing in our presentations, because we know that socializing is important, but we need you to stay physically distanced while socializing. So some general thoughts of people while they're getting together socially but remaining physically distant is to stay outside when possible, continue to wash your hands or use hand sanitizer often, keep at least 6 feet from others, not in your household. I know firsthand the temptation to hug someone you haven't seen for months. It's hard. It is second nature to all of us, but try to resist. But if you can't, wear your mask while you hug quickly and make sure you wash your hands afterwards. You can also limit your shared food, utensils, and other objects. If you're having a barbecue or a potluck, maybe designate one person who's wearing a mask to do the serving. I really want people to get together and reconnect, but I really want people to do that safely. So starting on Thursday, those of you who subscribe to Allegheny Alerts or watch the health department's social media accounts will notice that we are changing how we report the daily numbers. The revamped daily reports will focus on the latest cases reported to the health department. We will report the number of new cases and the total number of tests reported to the health department in the past 24 hours, the age range of the new cases, the date range of when the specimens were collected, the number of new hospitalizations and deaths reported to the health department in the past 24 hours, and details about those deaths. The new cases will be reported both as confirmed and probable, by age and by gender. The total number of cases, past and present hospitalizations and deaths will be included, but that'll be further down on the information we provide. And all the cumulative data to date will be on the COVID-19 dashboard at the county website. I hope the change in reporting will make it easier for people to see what is happening right now across our county. With the recent numbers, I am sure returning to school and reopening of schools is on the minds of many people in our community. School districts, colleges, and universities have been working all summer on plans to restart educating students in our community. This is an incredible challenge due to many of the unknowns, and I applaud the really hard work that has been done by school officials. Our staff at the health department have participated in calls with many school districts to offer guidance and support. And it has been a very positive experience and has given the health department a first-hand look at the challenges schools are facing and the innovative solutions they're coming up with as the school year approaches. School districts, colleges, universities, and the health department understand that returning students to school for in-person learning requires a balancing of public health risks, the risks of exposure and spread of the virus among children, teachers, and families, and the risks to education by keeping children out of classrooms. We really want children back in classrooms, but we also want classrooms that are safe environments for students and for the diverse staff that work in the schools. Unfortunately, there will be no 100% safety in reopening schools for in-person learning, and districts, students, and parents and families must be flexible to changing conditions. I also know this is really hard on people. I know people are tired of this pandemic. There is fatigue here in Allegheny County, across Pennsylvania, across the country, and across the world. I feel it too. It's been a really long 4 months, and unfortunately, we likely have at least another year of dealing with this virus. Yes, vaccine trials are starting, some right here in Allegheny County, and that is very exciting, but we still have a long way to go before a vaccine is approved, manufactured, and administered on a large scale to keep people safe. We are preparing for an increase in cases this fall. More people will be indoors, students may be back to school, parents may be back to work, and there's still all the scenarios where the virus could spread. That's why it is so important that we continue to take precautions to keep one another safe. Please stay home if you're sick and get tested. This will be critical in the fall as people may develop other illnesses with similar symptoms to COVID-19. Limit your trips out of the house and wear a mask if you do go out. Masks help stop the droplets that contain the coronavirus from spreading to others. Wash your hands, clean frequently touched surfaces often. Cover coughs or sneezes with your elbow and not your hands, and then wash your hands immediately. And please remember to take care of one another, be safe, and be kind. Thank you.
The first question that we have today is from the Post-Gazette. On Tuesday, the state's COVID-19 dashboard said that there were 175 hospitalized patients in Allegheny County, and the rolling 14-day average for the county was 127 patients per day. That's 5 times the average per day as recently as June 27th of about 25. What are hospitals telling you about their ability to deal with this surge? Are any of them at capacity or near capacity in specific buildings or units? And did the experience in spring help them prepare for this unexpected surge?
So I am in touch with the chief medical officers from all the hospitals, and they do report that they have plenty of bed space and plenty of ICU space. They are very careful at watching their numbers. and have plans to respond appropriately if they need to make more beds available. So I have not heard any concerns from any of our hospitals that they're anywhere near capacity at this point. Are they better prepared? That, you know, they all have lots of experience now taking care of patients with COVID-19, and that experience does help them, I'm sure, manage their patients more easily. Yes.
This next question is from Public Source. There have been multiple reports that it's hard to access COVID testing. Is this due to failure by the county, state government, or federal governments, or is it the result of people seeking unwarranted tests?
So we have heard from the public that getting COVID-19 testing in our community has been more challenging in the last couple of weeks. And the other thing we've heard is a big challenge is the turnaround time for those tests. And again, last week I made the recommendation that if you don't have any symptoms, to please leave the tests, prioritize people who have symptoms or close contacts of people with COVID-19. That being said, the availability of testing here, we've still been doing about 2,000 tests a day here, and that's an increase. We continue to work to expand that over time, and we'll continue to do that as a priority. There is a national demand for testing across the country because of the surges that are happening in a number of states and areas, and that has really impacted the availability of and quick turnaround testing in our national laboratories. But I understand that they are working to resolve that. But again, the turnaround time really is a national issue, not just a local one.
This next question is from a number of outlets and has changed in the last 20 minutes or so since it was submitted. So let me just throw out to you that there has been some news that has changed throughout the day regarding the potential that the Blue Jays would be using PNC Park. That was originally an okay this morning and now apparently has been denied by the Pennsylvania Department of Health. So people are looking for comment on what county's involvement is and your thoughts on that.
This request, the national government of Canada was not allowing games to be played in Canada, Toronto being the only major league team in Canada. We're looking for a place to have home games this season. There was some requests made by Major League Baseball to use PNC Park, which I think is, first of all, an honor that they would use us, but it also, I think, set up the way the schedule worked. I think that from my understanding is the Pirates would be away at the times that the Blue Jays home games were scheduled. So logistically it could line up. Well, obviously Toronto's probably one of the closer cities, Pittsburgh's one of the closer cities to Toronto in Major League Baseball. I think early on there was some thoughts out of the Secretary's office that it's something that could be done. And I think they had certainly had discussions with myself, Mayor Peduto, and others, Dr. Bogan. I think conditionally we were probably kind of okay, I say, not 100%, because anytime you bring an activity like that, there's going to be some risk. But obviously the governor and his team, Secretary Levine, decided that either the plans that they looked at or the mitigating strategies or the risk or something that they just didn't feel comfortable doing it. We know that the Pirates themselves are going to be playing again. No fans initially, and see how that goes. This is sports, and Major League sports particularly are uncharted waters that we're going to be seeing over the coming weeks. And I think everybody's going to be monitoring very closely testing of athletes, testing of staff and personnel to see how safely this can occur. So I think, again, this is something we're always going to have to be flexible about on just about everything, as Dr. Bogan said, with schools, and certainly sports and activities like that are also things that are fairly new, and we're going to see how they go, and things may open up even more or things may close down even more depending on the outcome of testing, contact tracing, and case investigation.
This follow-up question is from the Pittsburgh Business Times. Does the rise of the virus locally change your thoughts about the safety at PNC Park of just the Pirates playing their games there?
Well, I think, again, we're always concerned about any activity that's going to be a little bit different. We talked about schools. Is a month or so away from opening up, and a lot of folks are going to be coming into school sports, whether it be the Steelers, whether it be the Penguins, whether it be the Pirates, whether it be the Riverhounds, all looking to get back into action and be able to participate. We've seen some games and some other sporting activities around the country and around the world. And I think it's still early to see what the outcome is going to be. I know we're all anxious to get back to somewhat normal and watch our favorite team play and our athletes perform, but we also know that there's going to be risk. Anytime you bring a lot of folks together, there's certainly a potential risk, more so than if people are staying at home and being apart.
This next question is for Dr. Bogan from WTAE. We've heard from a lot of restaurants frustrated with inconsistent guidelines and conflicting communications from the health department's public statements to that of the state health department, like what qualifies as a meal, whether or not two people sharing one food item can get drinks, etc. What is being done to communicate clearly with restaurants?
Our county health department has held near weekly call-in events with restaurants to answer their questions. We have posted frequently asked questions on our website. We have called restaurants and provided information over the phone. The Pennsylvania Department of Health also has frequently asked questions on their website, and we remain available for questions from the public. And we, of course, now have the new program that County Executive described to you that will also address some of those questions.
This next question is from WESA. You've said before that it can take a few weeks for interventions like closing down bars to have an effect, and new cases appear to have dropped from their peak in recent days. But even before that was happening, the county had eased its prohibition on in-house dining. Why move so quickly to ease restrictions before we can be sure they will have a lasting effect on bringing cases down?
So our past experience with our first surge showed that it takes about 3 to 4 weeks for numbers to come down, and then another 3 to 4 weeks to go completely down. And we were at about 3 weeks at the time of the change. We were beginning to see a little bit of an inkling of change, and we really thought it would be helpful for us to be in line with the state orders. Again, they weren't that different from the state orders, and so it just makes sense as much as possible to all be in alignment in our public health orders. As you know, I did keep a couple of extra sort of safety measures in my order compared to the governor's order, exactly for those reasons, to be absolutely sure that we're being as careful as we can in our community, given that our high numbers. And again, as we had talked about when we started those mitigation strategies, it's about 3 to 4 weeks till you see an effect, and we're 3.5 weeks in, and we seem to be seeing an effect. So I don't want to count the chickens before they hatch, as they say, but I feel like we're demonstrating similar strategy to what happened in our April and May events that were happening now.
This next question is from WTAE. I'm working on a story tonight about how pro sports testing for COVID-19 could impact testing for Pennsylvania residents. We're already seeing a lag in results, so with players being tested daily and an estimate of 73,000 tests for the NFL alone, what could that mean for the average person who needs a test? Would it put even more strain on our system?
I don't know where they're sending the Major League or the football test to. I assume they're using a specific laboratory that is preparing their tests. So again, it depends a little bit on the national scene and where they're going. I really can't comment on that further at this point.
This next question is from the Post-Gazette. The county has not seen more than 17 new reported hospitalizations since this surge began, with most days only reporting 4 to 6 new hospitalizations. But the daily count of 175 from the state dashboard seems to indicate that many of these patients are staying in the hospital for a longer time. Does that concern you? Is there any information that hospitals are telling you about their treatment?
I don't have specific data on length of stay at my fingertips, but my understanding is that length of stay is not longer than it was earlier in May and June, that maybe it's a slightly lower, but again, I don't have specifics on that. So I think it was just that we had steady increases in our numbers. Again, hospitalizations usually lag behind cases by about 2 weeks. which is what I think we're seeing. And then again, we should start seeing those numbers decline about 2 weeks after we see the cases decline as well. And that's what I'm anticipating.
You touched briefly on some of this, but from WTAE, what is the latest regarding efforts to reduce the lag time from test to result? Testing companies have indicated they're becoming inundated. Has case investigation gotten any easier with smaller case numbers? And do you feel like we have an accurate picture of the virus in the county?
Well, that was a lot of questions in one. So let's take the first part of the question, which was about
What is the latest regarding efforts to reduce the lag time?
Yeah, so the lag time at national laboratories is an issue that is bigger than our county. Our county, the labs that are being done at our health systems are getting quick turnaround time. The tests we are using for the federally qualified health centers have been coming back within 72 hours of specimen collection. So there are some tests that are coming back quickly. It's really the tests that are going to the national laboratories that are struggling. And I know that there is an effort across the country to try to reduce that time because, as you said, it's actually important that we need data quickly so we can be actionable on it. And if it takes 10 days to get a result back, it's not particularly helpful. And so there is a huge effort, I think, across the country to try to get those labs caught up and to reduce the turnaround time. But again, many of the labs, local labs, are the hospital labs, the labs we're using for the FQHCs are turning things around pretty quickly. There was more to the question about...
I'll include both of these. Has contact tracing and case investigation gotten any easier with smaller case numbers?
So when we were having 300 cases a day, of course, that's a lot of people to call in a quick turnaround, and our goal has always been to do case investigation within 24 hours of notification. We got lots of help. We had help from the State Department of Health, who provided nurses to us. We had help from other organizations from the state that were helping. So that has been great. And yes, as the case numbers go down, it's easier for our staff to handle it. And again, we have kept up with our contact tracing as well. Again, through using our own staff and doing some flexing with that, and with the use of our Medical Reserve Corps. We've trained over 50 people in the Medical Reserve Corps to help us. And again, we had lots of support from many people in the health department and other agencies as well. So yes, we've caught up, we've kept up, but as the numbers get higher, it's more of a challenge.
This next question is from WESA. When the county began reporting the median age of those newly diagnosed with COVID, it was typically in the high 20s, but now it ranges between the high 30s and low 40s. Is that a sign, or have you seen other evidence that the disease has spread from younger people to an older generation?
I think that we see, the numbers we report from infancy up through, close to 100 years of age across all of our days. But again, that number would suggest that we're getting some spread to older people again, and so we'll keep an eye on that very closely. And that is one of the reasons we talk so much about people being very careful in intergenerational homes and intergenerational workplaces, to be careful to wear your mask, to keep your older folks and more at-risk folks really safe.
This next question is for the county executive from the Post-Gazette. What kind of pushback are you getting for the new restrictions and changes to the restaurant and bar order? Are the businesses complying, or are you hearing resistance to that?
We're actually hearing more cooperation with regard to that. And obviously the state came along and also did their restrictions that they did about a week or so ago. Dr. Bogan and her team were ahead of it very early on, late last month and early this month, coming together with a very strategic strategy, starting with more restrictions, and then easing off about a week or so later, and then a week or so after that, easing off even more, following the state with indoor dining, 25% capacity, et cetera, and the other things that you talked about, smoking and the 11 o'clock restriction. So it's a balance. It's obviously a balance to see where these contact tracing investigators take you, where the case investigators show that these things are happening, and making strategies accordingly. There are great examples throughout this country of other places, other states that didn't take an action in which they kind of came to a crossroads and could have gone one way or the other. And I'm sure right now they had wished they had gone along the lines of what Dr. Bogan and her team did, because there are states that are now being overrun with a lack of capacity in their hospitalizations. Their death rates have gone up. Their cases spiked incredibly. They didn't put some of the mask restrictions in, some of the restaurant and bar restrictions in, and right now we're glad here in Allegheny County and in Western Pennsylvania that we're not following where some of those other states have gone. So this is something that's always going to continue to change. Dr. Bogan and her team don't take these things lightly. They do a lot of work and a lot of investigation to try to come up with a strategy to keep people safe, but to try to keep as much normalization within our activities and economy as we can.
These final two questions are for Dr. Bogan. This first one is from the Post-Gazette. While cases are up dramatically and hospitalizations eventually followed, we've not yet seen a surge in deaths. Do you expect to see a related surge, or are hospitals telling you that because of the demographics of the group of patients and improvements in treatment that we won't see a dramatic spike?
I hope that we won't see a dramatic spike. Again, hospitals have learned how to manage these cases better. They are more younger cases, as you said, and hopefully it's keeping out of our long-term care facilities as much as possible as well. So I think all of those strategies, with that, we should hopefully not see a huge surge in our death rate here.
And this is the final question from WTAE. Where do things stand regarding increased accessibility to testing for those who are in low-income neighborhoods?
So our federally qualified health centers, as you know, we've now been testing at those sites for about 2 months. We've seen a pretty steady increase in the numbers of tests that they're offering. People are really using up all of the slots. Sometimes they don't have any slots open at the end of the day, so that's great. They have also made available testing where they go out into the community and being really responsive to those communities that need testing in them. And we continue to work with organizations to try to get testing to parts of the county that need it. So again, one of the interesting things is the overall testing done across our county per our NEDS database is about 20% among communities of color. And if you look at the COVID testing, the testing done at our federally qualified health centers, it's about 50% of all the tests are to communities of color, or people of color rather. So I think that is fantastic. They're reaching the communities where people live, can walk to get to. And we continue to try to provide mobile testing units to places that don't necessarily have a federally qualified health center right in them. So I appreciate all the efforts, and we are continuing to work with a couple of other organizations to even expand that further. So we'll let you know when those become available.
That was the final question. If there are any closing remarks?
Well, I want to thank Dr. Bogan and her team for the great work that they've done, but also want to thank this community, because one thing I know about this community is we rise to a challenge. And I think in early June, while we were doing very well in March, April, May, and then early June, and we saw numbers very, very low, which we were one of the only places in the country with the density that we have to see numbers that low. And I think we got a little bit complacent because we missed being with our friends, we missed being with our family, we missed having normal operations, which we all miss. We all want to be with people. As Dr. Bogan said, we're social people. We want to be with our friends and our family and be together. And then we saw our numbers start to go up, uncharacteristically for what we did. But then after a few weeks of difficulty, I think this region decided, we rose to the challenge, deciding to follow the advice of our health professionals. We have all learned a lot about this since mid-March when it all became part of our lexicon. Not just the folks at the CDC and the NIH, Dr. Levine and the health folks at the health department, folks at the state, Dr. Bogan and her team, and our hospitals, our healthcare professionals, all of us learning the strategy, how important this mask is. The president now has also signed on with every other elected official at state, local, federal, talking about the importance of masks and how we need to work and use our masks, and also the social distancing and the other strategies that we know about indoors. So let's continue to be vigilant. Let's continue to wear that mask, keep distance, and we can open up as many things as we can to get back to somewhat of a normal lifestyle, particularly as we open up schools and other activities that we want to see all of our families and our kids and everybody be involved with. So let's continue the great work that everybody's doing. I hope those numbers continue in the right strategy, and let's continue to wear our masks.